Connecting. Okay. First I have to introduce the audience for speech. Go this way. Can you see yourselves?
Yeah.
No, you can't. If you can't see yourself, you gotta tell me because I gotta put you on here. Okay. Okay. Ba-bum. 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 Can you guess what that is? It's your heartbeat. Now I'm probably going to make a few of your hearts beat a little bit faster after you hear my speech this evening. As most of you know, I am Denise Pfeiffer, and I'm going to tell you about heart disease in women. According to the American Heart Association, 1 in 4 women each year who die from heart disease. That's an average of 8.5 million women a year, which makes up for 1/3 of the women's deaths in the U.S. alone. Dr. Elvin Silverstein defines heart disease as any disease affecting the heart. It's not just one disease, but it's a number of heart and blood disorders. One common form of heart disease is heart arrhythmia. This is a constant change in your heartbeat causing most sufferers to feel dizzy, out of breath, or even sometimes chest pain. About 6 months ago, I was diagnosed with this disorder, and I have a history of congestive heart failure in my family, but never this. 2 other common forms of heart disease are coronary artery disease, which is when the heart arteries become hardened and they narrow. This normally leads to a heart attack or angina. The other is heart failure. This is when the heart can't pump blood to the body as it should. Heart disease can affect women of any age. It can affect the elderly, it can affect the middle-aged, it can affect young adults, it can affect teenagers, it can affect children, and even infants. 2 categories of women are more at risk, and those are postmenopausal women and women taking any form of birth control. Estrogen replacement therapy does not lower this risk, sadly, for women who are postmenopausal. Number 1 reason why most women who have heart disease die from it every year is that they wait longer to go to the emergency room than men do when they start experiencing symptoms of a heart attack. It also doesn't help the matter that doctors are slower to diagnose and recognize heart disease. That's because the common characteristic pattern of heart chest pain isn't evident in women, and an EKG changes aren't usually noticeable. That means that you need to know the warning signs yourself. Some of the warning signs are abnormal heartbeat, tiredness, dizziness, shortness of breath or lack of air, nausea, and chest pain. According to the American Heart Association, though, 2/3 of heart disease deaths in women occur because the women never even experienced chest pain when they thought it was simply nausea also that they were feeling. According to Prevention magazine, women often experience different symptoms like heartburn, loss of appetite, tiredness or weakness, shallow coughs, or heart flutters, which feel like small palpitations that you get in your lower throat. This was my warning sign. 71% of women just experienced extreme flu symptoms when they were actually having a heart attack. The good news is that any woman who catches heart disease early enough can live with proper treatment. Lifestyle changes like diet and exercise are one way. The other is medication. I treat my disorder with metoprolol, which is a medication taken once daily for me. Sometimes surgical intervention is necessary, and that may involve having a defibrillator or a pacemaker implanted into the heart. According to Prevention magazine, a woman's heart responds better than a man's heart to simple life changes that I stated previously. I'd like to grab your attention a bit more with some heart-jerking numbers from the Center of Disease Control. Did you know that 8 million women in the U.S. are living with some form of heart disease, and 35,000 of those women are under the age of 65? I didn't. 42% of women who have had a heart attack died within a year. Now let's compare that to only 24% of men who had that same fatal rate. Under the age of 50, women's heart attacks are 2 times more likely to be fatal than a man's. After the age of 50, men and women have the same rate. Lastly, 6 times more women die from heart disease than breast cancer. The awesome news from all of that is that being informed has made a difference. According to Dr. Elvin Silverstein, the number of deaths in women and men from heart disease is starting to decline every year and keeps going lower. Some of this is in part due to support that you may get from the American Heart Association or the Go Red for Women campaign, which I'm sure some of you are familiar with. That campaign is a group of women, researchers, and doctors who are dedicated to making the numbers drop even more faster. Their goal are to educate and inform women on the risks. They support women who are victims of heart disease, as well as research advancements in teaching women about prevention tips as well. The Go Red campaign is also offering a Better You whole body makeover online for anyone to join. I joined it 2 weeks ago. This is a makeover from the inside out. It allows women of all ages to participate in the national 12-week program that teaches you lifestyle changes and guides you on the path to making a healthier you. They also offer online coaching and an online journal as well as weekly and daily tips to help you even more. All you have to do is go online. You'll be glad you did, even if it's just to check it out and find some more information. I'd like to leave you with some food for thought. First off, there are a few things you should know when you go to your doctor. Number one is, don't just think shortness of breath is caused by anxiety. It is caused by anxiety, but not having the ability to catch your breath is a sign of a heart or a lung problem, and the two are most commonly confused within each other. Number two is that your normal HDL, which is your good cholesterol, is 60, but postmenopausal women who have borderline numbers have to have a CAT scan with a calcium scoring, to detect the plaque or the blockage that they may be having. Finally, number three is don't think you are fine because your doctor tells you that your major arteries are clear. This is for men and women. But mostly, it's a bad thing to hear for women because most women who have heart disease have trouble with their small interior arteries and not their major arteries. And this kind of blockage is only detected by taking a nuclear stress test. Lastly, I'd like to make sure you know the risks that you can do yourself to lower and prevent heart disease, according to Prevention Magazine and the Women's Health Association. These risks are the lack of exercise. Just keep moving. Walk the steps instead of the elevator. Park farther away from your building. And play with your kids. They'll love you for it. Smoking is a risk also. Women who smoke usually die 19 years earlier than women who don't. Obesity. Check with your doctor for this number. Not everyone's ideal weight is according to what the internet tells you. Every woman's body is differently. Their metabolism, it all affects that rate, and the number that you have in mind might be way off compared to what your doctor is saying. The other risks that you can lower are hypertension, which is high blood pressure, the amount of fatty foods you eat. Make a healthier lifestyle for your kids and show a good example. They might take it up to their adulthood and carry it out to their children. And try to lower your stress. It also helps to know if you have a history of diabetes or are at risk for diabetes in yourself or your family. Basically, just stay informed. Be aware of your body and make the choice to not be a statistic. Keep your ba-bum, 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 taking healthily for a lifetime.